Mabuhay, future nurses! Welcome to Pediatric Nursing 101 with me, your student nurse, Edmund. In this video, I will be performing the EINC, otherwise known as the Essential Intrapartal Newborn Care. So these are 4 time-bounded interventions that is done within on 30 seconds right after the baby have been delivered. So it is composed of 4 interventions: immediate drying, the skin-to-skin contact, the proper timing and cutting of the cord, as well as the non-separation and initiation of breastfeeding. So, this EINC actually, before doing this, we have to prepare the materials that we need for this procedure. So after we prepare the materials, we have now to prepare for the delivery. And then we wash our hands and put on sterile gloves aseptically. So we are going to use 2 gloves in this. We are going to use 2 sterile gloves when assisting in delivery. The first gloves is we will be using when we assist in the delivery, and then the second glove is that we will be using it before we actually cut the cord. Because the baby is sterile, we have to make sure that we practice aseptic technique all the times. So without further ado, let's get started. Time of birth, 1:42 p.m. After calling out the time of birth, we will be placing right away the newborn into the mother's abdomen. In this part, in this part of the mother, this is where the part that we will be going to dry the baby using a towel. We start drying the baby in the eyes, nose, face, the back. And then we remove the wet towel. What are the things that we have to consider when drying the baby? We have to do this within 30 seconds right after delivery, and then we should not wipe off the vernix caseosa. Why? Because vernix caseosa provides additional warmth and prevents baby from having hypothermia. We should also remember that the baby should not be bathed within 6 hours after birth because it can cause infection and, of course, hypothermia. Now, we come now to the second part of the essential intrapartal newborn care, which is the skin-to-skin contact. We will be placing the newborn prone into the mother's chest. And then, we will be placing a bonnet into the newborn's head. And then cover the newborn's back using a blanket. Okay. And now we will be observing for the proper timing and cutting of the umbilical cord. But before that, we will be removing our gloves. And put on another. Now we will be cutting the newborn's umbilical cord. We have to wait until the pulsations stop, and we should not be should not be milking. We must not milk the umbilical cord towards the newborn. Now, if we felt that the pulsations have stopped, we'll be placing a clamp 2 centimeters away, 2 centimeters away from the newborn's abdomen, and another clamp 5 centimeters away from the newborn's abdomen. And then we cut it using a sterile instrument. After cutting the umbilical cord, we will be administering 110 international units of oxytocin intramuscularly to the mother. Administering this prevents the mother from having uterine atony. So we will be injecting oxytocin intramuscularly to the mother. And then we will be discarding now. Now, we will not be separating the mother and the baby because it promotes skin-to-skin contact. Now, we also have, as early as possible, within that 90 minutes, we have to initiate breastfeeding. Now, if we assess that the baby already have the rooting reflex and any other reflexes present, we can say that the baby is now ready for breastfeeding. And that is the fourth part of the essential intrapartum newborn care, the non-separation of the baby and the mother, as well as the initiation of the breastfeeding. So, to sum it all up, the four time-bounded interventions that we do right after or within the 30 seconds after birth is the immediate drying, the skin-to-skin contact, the proper timing and cutting of the cord, as well as the non-separation of the baby and initiation of the breastfeeding. So that's how we perform EINC, or the essential intrapartal newborn care. So once again, we have now to remove our gloves and discard it and perform proper hand hygiene. Once again, this is Edmond M. Bigata. Have a good day ahead.